Hello, this is Charles Reynolds, and I would like to explain to you exactly what is a vampire facelift. It's been on the Doctor Show, on Dr. Oz, it's been in many magazines, multiple celebrities now have had it. Kim Kardashian, it's been at the Oscars, it's all over the world. What exactly is a vampire facelift? Well, before we get to the exactly what it is, let's talk about beauty in general. What exactly is beauty? Beauty is, and really any appearance of anything can be defined with four components: the size of it, the shape, the color, and the texture. And of all those four things, which do you think would be the most important as far as creating this feeling, this emotion of being attractive or being beautiful? Well, before we get to the answer of that, which there's the answer, it's shape, but how does that come about? Let's talk about some of the people who have thought about beauty. Richard Feynman was an amazing, some consider him one of the premier physicists who ever lived. He won a Nobel Prize in physics in 1965. He helped construct the atomic bomb. He figured out the reason the Challenger exploded, and obviously a bright man, but he was also fascinated by beauty. Look at this. This is a page, a photograph of a page of one of his notebooks. Notice in fine print, you see where he's working on mathematical ideas and theorems, and right on top of that, or who knows which is on top of what, but simultaneously on the same page, he's sketching figures, faces, and the figures of women. He actually worked on many of his math theorems in a topless bar in London. If you look, you can even find his art for sale. Here's a sketch he did of a woman reclining, another sketch of a face. He was fascinated by beauty, not just beautiful faces or beautiful figures. His sister was learning to write Chinese, and Feynman decided to play a joke on her and write her a letter in Chinese, surprising her that he would know how to write in Chinese. And during that process of learning, he became fascinated by it. You could write the same character in Chinese, and one might be beautiful while the other might not be beautiful, depending on how the same character was written. So, as a mathematician and a theorist, he wanted to figure out why that is so. He's not the only mathematician who did that. This is a photograph of a page from Leonardo da Vinci's notebook. It's a famous sketch that Leonardo did, and you can see the lines there making geometric shapes. He was, of course, a mathematician as well, and an engineer, and had a resume that was probably the most crazy resume of any person who ever lived. He was a musician. He was in charge of parties for the king. Um, and of course, he was a scientist as well as an artist. And he was also fascinated by why is one face more beautiful than another, and did measurements and tried to define the mathematics of that. Here's a photograph from an article about one particular measurement that can be made called the E line from more recent research that's done. And this Dr. Marquardt, who is still living in Southern California, was an engineer before becoming a dentist, and was also fascinated by beauty. And what I'm getting at is when these mathematicians are trying to define what exactly is beauty, it comes down to some math. And Dr. Marquardt, an engineer, took photographs of beautiful people, and he decided the test of that might be people who are being paid to be looked at, people who have been photographed for magazines or for movies, living in Southern California. He could find those people fairly easily, photograph them himself, and then use calipers to measure how their face was constructed, and later use those same measurements to construct topographic maps of the face. You can see one there, but break here and let's go look at his website. Just see how beautiful these are, and some of the work that he's done. It's really fascinating. Here's you go to beautyanalysis.com. And check this out. Here's the mask on the face, but it gets more interesting. If you look, that same mask can be applied to every ethnic group. And even more exciting, that same mask fits on the artwork from different ages. So all the way up, here's the mask on the sculpture. At different ages on different continents, even. So the interesting thing is, where did this come from? Why do we have this embedded in our genetic code that we might be attracted to a particular shape? No one really knows, and people debate about the validity of this mask, but no one really debates about the fact that shape seems to be an important component of beauty. Here's a photograph of the man for whom the Elephant Man movie was made. The story was about this gentleman who was a very educated and lovable fellow, but obviously had a shape that no matter what the color or texture, you might find he would not be considered attractive, at least on the outward appearance, by most people. Where, if you look at the Blue Man Group, if you've seen them perform, these are very attractive men, even though they are blue. The point of all this being that shape is extremely important, and probably the most important component of defining what exactly beauty is, which of course we're getting around to what makes a vampire facelift and why shape is embedded into the ideas behind the vampire facelift. Here's a photograph of a woman who you can see she has this nasolabial fold, nasal, nose, mouth, labial. This fold has been filled with a filler, Juvederm or Restylane, I can't remember which, to make a fold go away, and also the upper part of her lip was filled to help pull out the scar. And the fold or the wrinkle went away, but the shape de-emphasized her cheek and overemphasized her upper lip, creating a shape that looks tired and not as attractive as it could be. Here's from the front, and you can see this is not a very attractive shape. Some people say overfilling that nasolabial fold creates sort of a chimp look, in that it makes the cheek go flat and pulls out the upper lip. And you can kind of see that in this frontal view, where I tried to compensate for that by bringing the cheek out more, and this is the same woman reshaping the cheeks and trying to bring the lower lip out to match the upper lip. Shape makes beauty. Here's a woman, the day I met her. I've been taking care of her now for 10 years or so. This is the day I met her. And you can see she has loss of volume under the eyes, and the cheeks are flat. And then this is after one syringe of Juvederm. So people say, well, this is not even the whole vampire facelift. This is just the Juvederm component of it. And you can use platelet-rich plasma. You could use some other things, and you'll hear about that part of it, the growth factors, in a moment. But you could do things under her eyes without using you could do things under her eyes with just growth factors. But to lift her cheeks out, it's hard to be a structural filler that holds a shape. You could also put fat in her cheeks. The problem with fat is you can't sculpt exactly with it. You're back to this sort of idea that you can make a fold go away, but you can't exactly sculpt a shape. So using an hyaluronic acid filler was able to sculpt a very beautiful shape in her cheeks and under her eyes and bring out her brow and her mouth just with an HA filler. But that's not what a vampire facelift is. It's just part of what a vampire facelift is. So I treat patients just with an HA filler like Juvederm or Restylane, and I treat patients just with growth factors like I'm about to talk about. But the vampire facelift is a combination of those two, using the fillers to create a structure based on what makes a beautiful face, and then polishing off that sculpture with the component I'm about to describe now, which is platelet-rich plasma. So this is just a test tube like you would have blood drawn into in the laboratory if you're having a blood test done. And after putting it in a centrifuge, which I did with this tube, the red cells, or the red blood cells, go to the bottom because they're heavier. And then the platelets and the white cells sit on top of that. That's that pinkish white material. And then mostly water or plasma is on top of that, and that's the yellow material. So things layer out based on weight. Now, where the platelets are, which is what fertilizes stem cells in the tissue to cause growth, it's the yellow goo that was around the scab when you skinned your knee as a child, and you didn't get new skin from the Walmart, and you didn't just seal your skin back together. You had to grow new skin. You had to generate, your body had to grow new skin to fill in the skin that was pulled away when you fell on your bicycle. And what caused that skin to grow was that yellow goo that was around the scalp, platelet-rich fibrin matrix, which happens when platelets are exposed to growth factors. Which happens when the stem cells are stimulated or fertilized by the growth factors in the platelets, and the platelets release those growth factors when they're exposed to calcium. So here's a tube that was designed, an FDA-approved tube or a kit that was designed to isolate those platelets. So you see that white material in the center. That's designed to float up on top of the red cells, and the platelets are on top of that. So there's over 17 now of these Food and Drug Administration FDA-approved kits to isolate those platelets. And all the vampire facelift providers are using an FDA-approved kit. Now, the FDA does not approve procedures. It's not their job. They approve devices, and they approve drugs and food. They don't approve procedures. So, for example, if the physician is using a suture to sew up a wound, then that suture has to pass through the FDA so that the doctor knows that it's sterile and that it will hold tissue together without pulling apart. But the FDA doesn't tell the doctor how to tie a knot with the suture material or how to sew a wound together. That's left to the doctor's knowledge based upon his experience with taking care of patients and the current medical literature. In the same way, the FDA does not tell doctors what to do with blood products. Doctors are governed by their own research and what they know about the body and medicine. So most of what's done with Juvederm, for instance, using Juvederm in this lady's eyebrows and using it in her cheeks, is not an FDA-approved use of Juvederm, but it's commonly done and taught by physicians, and they commonly do that. But the people who make Juvederm are never going to do lots of research to prove every spot on the face to the FDA where Juvederm can be used. So that's called an off-label use of a drug. But when physicians use, and it's commonly done, oncologists, 40% of the drugs they write are off-label. That is, they're using the drug in a way that's supported by the medical literature, but not proven. You can prove something to the satisfaction of physicians and to the boards of medicine without spending the money to prove it to the FDA. FDA has an important role, a critical role, and is considered to be a wonderful test of devices and drugs all over the world, not just in the United States. But they have their limits. They're not made to govern the way doctors practice medicine. It's not their function. And they're surely not there to govern the way doctors use blood components, blood products, which are not even a drug. But they are there to govern the devices that are made to make sure that they're truly sterile and that they are truly producing the plasma that doctors think they're getting, so then the doctor can do what he knows as a physician with that material. So vampire facelift doctors, all the doctors on the vampirefacelift.com website, are using truly FDA-approved kits so that they know they have sterile material. The only serious consequence from plasma was one case of death in China from infection, and it was in a person who was treated with blood prepared with a kit that was not FDA approved. So, um, and that is the only case anywhere in the medical literature of severe complications from blood products that are used, the platelet-rich plasma that are used in the vampire facelift. Now, people have complications from transfusions that are done in the wrong way, but platelet-rich plasma, where you take it from a patient and then you give it right back to the same patient as an autologous is the word for that, that has never had a complication, serious complication, ever, not one time ever in the medical literature, which is what you'd expect, because if the blood was going to cause complications, then it would have done it before he took it out of the body. So anyway, it's a very safe material. And I get that question about the FDA, so I wanted to clear that up. Here's pulling that material out and then injecting into the face. So you can use this by itself, inject under the eyes. You get really nice color texture changes with platelet-rich plasma because it causes growth of tissue. It causes, including new blood flow. So you get a rosy appearance of the cheeks, like with a child that's been playing outside. So what happens if you combine the two? What if you use, as in using Juvederm or Restylane or one of the other hyaluronic acid fillers, like are normally used to shape the cheek, as I showed you previously, and you put platelet-rich plasma on top of that? Well, there's actually a lot of research on that as well. Most of it is in the literature where doctors have studied how to take care of wounds. So here is an old wound. Here's an old scar. You can see in that, on your right, the woman's left ankle, it's called an atrophic scar or atrophy from a cortisone injection that leaked out of her ankle and caused the muscle and skin to become very atrophied, almost translucent. She was embarrassed to wear a dress. This scar had been there a year. It had been biopsied by a dermatologist who did not know what I'm about to show you and told her there was nothing to be done. So she read about the vampire facelift and asked me if I could treat this scar. Came into my office. I put 1 syringe of Juvederm and put some PRP or platelet-rich plasma on top of that, which is what I just showed you, getting those platelets off the top of the red cells and inject them in this area. This is a few days later. That's a year later, 1 year later. Actually, it looked very good after 1 month. So, when people ask me, how long does the vampire facelift last? We are growing new tissue. So you'll be a year older in a year. If I do a vampire facelift on you, then you're going to look much younger and still look natural that day. But a year from now, you'll be a year older. But the material, the new growth, will still be there because there's not a material to fade that Juvederm or Restylane acts as a scaffold for the growth factors to attach to, and then the stem cells to grow new tissue over that scaffold. So here's an example of the whole procedure using an HA filler like Juvederm was actually used in this woman. And here's the day after. Juvederm was put under the cheeks and the brow and the lateral part of her lower lip to roll it out and re-expose it. And this is the day after. You can see one tiny little bruise under her right eye. Otherwise looks beautiful. So, in summary, the vampire facelift is the combination of using a hyaluronic acid filler, like we did over here, to shape out and make a beautiful shape. And that's a true facelift. That's lifting the skin away from the bone. It's re-inflating the face. Now, there's a place for a surgical facelift for tightening the skin, but and many of the vampire facelift providers are amazing surgeons. They do excellent surgery, and they'll tell you whether you'd be better off with a surgical procedure or a vampire facelift where you're actually lifting and reshaping, and there may be a combination of the two. But this is a facelift because it lifts the skin away from the bone, creates a new shape, and then using the plasma and the growth factors, creating new color and texture so that that's the end result. Now you can use all the vampire facelift providers they can still use one of the other by themselves. So they might just do Juvederm, or where they just want to do the shape, and color texture is great. Or maybe shape is beautiful and they just want to have color texture changes. In that case, they may just use the plasma. But if both are desired, both color and texture and shape, then the Vampire Facelift is unique in that it provides all of those in one procedure. So that's where you can find a certified provider. This is a trademark procedure, and there are those, just like any trademark name, it's very valuable, and there are those who would like to claim the name who don't really understand the procedure. So if you go to actually the U.S. Patent and Trademark Office website, just want to show you how you can find this. If you go to uspto.gov and then you search under trademarks and you put Vampire Facelift in there, you'll see this is an actual protected, it's called intellectual property. And intellectual property is property. So I can't hang out a McDonald's sign just because I like their hamburgers. I have to know how to make a McDonald's hamburger and how to get it to you in less than 10 minutes and the whole process. So people who think they're doing a Vampire Facelift, as some physicians have, just because they are using plasma in the face, are wrong. Because what they don't know is how the true Vampire Facelift doctors are creating that structure with the Juvederm to shape the face in a beautiful way. And also the Vampire Facelift doctors are using FDA-approved kits. They understand how to activate them to get this sort of result. If you're not seeing someone who is licensed to use that name, then they may be doing amazing procedures and getting wonderful results, but they may not be, and you're taking your chances. So anyway, this procedure can be used to treat scars. It can help the color and texture and restore shape. To learn more about the procedure or to apply to do the procedure, if you are a physician or nurse practitioner, then I'll show you where to go. Also, if you want to read more of the research, it's all posted here. You can just go to vampirefacelift.com vampirefacelift.com, and here's where the research is posted. Here's a video of me discussing the research at a conference, and all this about the wound care literature and how plasma helps the skin is there. There's a little book that you can buy that explains it in more detail, about $15. Here's, if you are a physician and interested in doing the procedure and learning the whole process, then you can go here and there's a video and a place to apply to become a provider. Let me show you how to find a provider. If you go to right here, find the provider closest to you, then you can pull someone up by zip code or country or state. Now let's see, we could go to Arizona, and then if we were interested in someone, we could just click on their listing and you'll get a Google map of where they are. So that's the Vampire Facelift. Thank you very much. Please let me or one of the providers know if you have any questions.